Public health attends to the health and well-being of populations. This is the essential distinction from clinical medicine, where the latter is especially concerned with the health of individuals. Public health tends to emphasize prevention of disease, community-wide interventions, a global perspective, and attention to the issues of equity. When we speak of precision public health, it's a concept that puts increasing specificity into the main lines of effort that make up the public health enterprise. 4 dimensions are worth stressing. First, understanding the causation of disease or of disability or of diminished well-being in the broadest sense of health. Secondly, assessing the risk of developing disease. Third, designing interventions that reduce risk or that promote health in a population. And fourth, targeting to a more narrowly defined population or subpopulation. Precision public health, in my view, is best understood as a process that is transforming the whole of public health rather than as an emerging field of expertise or a discipline within public health. Understood in this way as a process building toward increasing specificity of understanding, of assessment, of designing and targeting interventions, precision public health has its roots in the very origins of public health, from the earliest speculations about the cause of illness or of death. As a modern concept, the idea of precision public health is only about a decade old, and it is evolving.
Now, my understanding of precision public health is actually, to simplify it, is the application of new health technologies and innovations like genomic, big data, artificial intelligence, and digital tools, etc., to enhance the precision of public health policies. And I emphasize the word policies and interventions in disease management for the benefit of the health of the people.
A few words on precision public health in relation to precision medicine. Both of these fields, or both of these endeavors, rely on the same basic discoveries and technologies. In public health, we talk about precision in causation. In medicine, precision of etiology and pathophysiology. In public health, it's precision population risk. In precision medicine, it's diagnosis and prognosis. In precision health, we talk about precise interventions targeted at more precise populations. And in precision medicine, we talk about more specific treatments narrowly targeted to different organ and cellular targets within an individual. So while public health has and always retain its distinctive focus on the whole of the population, as precision public health evolves and increasingly discovers subpopulations that may represent the best target for a particular public health intervention, the ultimate limit of subpopulation is down to the individual patient. And that in turn may eventually lead to another point of intersection between public health and medicine, both benefiting from the discoveries and technologies that make precision public health possible. An interesting example illustrates the duality of precision medicine and public health based on a technology developed by a company now called Propeller Health that adds an FDA-authorized geospatial positioning device to an asthma patient's inhaler. Now, what this does is allow the recording of exactly when and where any patient uses their inhaler. And these data in turn lead to guidance for both individual use to forestall hospital visits, for example, and from a public health perspective, to document the population effect of changes in concomitant air pollution levels. So in this case, one AI analysis suggests that on average, every 12% change in 2.5 particulate matter, that is particulate matter with the size under 2.5 micrograms, results in a 0.82% increase in the weekly average inhaler use. Now, this illustrates the way in which these potentiating technologies apply both to precision public health as to precision medicine.
Precision public health is at its nascent stage, some experts mention. So going forward, what are some of the things that would help us to realize the power and the potential of health technologies and innovation? The first, the most important one is, of course, acceptance by the community. If the community doesn't accept it, whether because of ethical issues, whether because it is privacy issues, or whether or not it is technology issues for old folks like me. So acceptance is important. And we need to think of the wider community, not just young folks who are very knowledgeable with new technology, but think about across the whole, the life spectrum, and try to educate people when the opportunity arises. Now, monitoring of and evaluation of public health, whether or not what we want to emulate, to promote in a certain country is first and foremost effective and cost-effective, and of course, useful. Fairness, I mentioned this. And of course, equity is a big issue. The growing inequity in every country and between countries is something we need to address, not only by precision public health, but by the wider community, and of course, by policymakers. Now, I really believe that the potential of precision public health to promote health, and allow me to quote Dr. Richard Holton, the chief editor of Lancet. And he said, precision public health is about the power of data to improve health and to achieve social justice. And I fully agree with him. And of course, the list of suggestions on going forward are something that are very useful for us. And I believe solutions can be found or created because there is no limits to human ingenuity.
I want to speak briefly to the content of education and implications for training in public health. In particular, the growing importance of these driving discoveries and technologies, big data, artificial intelligence, geospatial positioning, and the whole array of moleculomics means that increasing familiarity and exposure to the content of these very fundamental technologies will be increasingly important for future public health practitioners and leaders. The advent of precision public health puts a special premium on cross-disciplinary collaboration with deep experts in these driving technologies and on sharing across nations to take fullest advantage of the advances in precision public health for all people. Public health has always been a problem-driven rather than a discipline-dependent field. It means that researchers and practitioners of public health have always drawn on whatever disciplinary expertise is required to meet the health needs of a population. In this spirit, precision public health simply amplifies and places added premium on these special fields of expertise that will be increasingly important for public health.
What are the opportunities and the challenges for, precision public health? And I fully share Dr. Harvey Feinberg's comments about the need to have a new model of education, training in public health for our future public health leaders. Precision public health puts a premium on our ability to stimulate and to actually implement cross-disciplinary collaboration with deep experts in these driving technologies.
from my vantage point, every future health leader and public health professional really needs to have an increased level of convergence and thinking about the roles of these several technologies to their work, to their thinking, to their policy making, because it expresses itself in so many different levels. So what that means in practice is that an educational program has to provide a degree of familiarity with data systems, with big data, with data display, with the issues around privacy and mobilization and utilization of health data. That every public health practitioner really needs to understand the role and potential for the moleculomic revolution, from genomics, proteomics, all the way through the microbiome and the metabolomics in between. And then you have the other areas of application that are going to be increasingly important, where you have the opportunity, whether it's in the face of a pandemic or dealing with a long-standing chronic disease, whether it's at the level of national planning or at the level of local community implementation, to take advantage of these tools, to use them in creative and innovative ways to meet the health needs of the people we're trying to serve. So I see precision public health as becoming an increasingly prominent way of thinking in public health. At one level, when it applies to the targeting of populations, it is going to challenge traditional ways of thinking about optimal public health interventions. Traditional in the sense of applying an intervention to move the whole of a population from an average of A to an average of healthier B, as a very different approach than the targeting of particular individuals to meet their individual health needs according to precision public health lessons. These are going to be not contradictory, but complementary approaches as we proceed to take advantage of all the new tools to advance public health. So in short, David, I see these approaches, the philosophy of precision public health, the technologies of precision public health, the applications of precision public health, as increasingly prominent parts of every public health professional's education. In public health, we're fond of expressing the concept of health in all policy. One of the consequences of precision health, I believe, will be to attract many more disparate disciplines and a range of expertise to the field of public health. And we should be prepared to embrace them, to incorporate their expertise in service of the core mission, the health of populations.